This child's terrible cough, coupled with a high fever and breathing difficulties, got him admitted in Mulago Hospital, where he was promptly put on a ventilator to support his breathing. The doctors at Mulago's acute ward say they receive at least 12 children with pneumonia daily. This figure confirms statistics from international health journals that rank pneumonia as the leading cause of death among children under 5. But a new report by the Makerere University College of Health Science indicates that 4 out of 10 children who are taken to health centers with symptoms associated with pneumonia are actually suffering from asthma.
And we discovered that 4 in 10 children actually had asthma but had been misdiagnosed as pneumonia. And because they had been misdiagnosed as pneumonia, they had been treated with antibiotics, and some of those children had missed out on the asthma medicines.
The research was done at the Children's Ward in Mulago Hospital. 614 children were examined by officials of Makerere University's Child Health and Development Center in collaboration with the University of Copenhagen. They recommend that the agenda of setting up a diagnosis of asthma in children be put in place.
If we decided to include asthma very clearly, how do we diagnose children with asthma, how do we assess them, how do we treat them, then we will be able to reduce the problem of misdiagnosing asthma in these children.
The Ministry of Health is looking at strengthening the diagnosis and treatment of children, as well as training health workers with a grant from the UN Commission on Life-Saving Commodities.
We are going to use this fund to make sure that we have formulations that the children are very user-friendly to the children and can address the key diseases and illnesses among children.
Some of the symptoms of asthma are high fever, cough, shortness of breath, and rapid breathing. These symptoms are similar to those of pneumonia. The best way to detect asthma is to use a lung function test. Irene Namialo, NTV.